Good evening, everyone. I'm Sayukta, your host for today's live from All About Skin Allergy team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones do have encountered at some time in their lives. Urticaria is characterized by a round rash on the skin that itch a lot. It may be due to the chemicals present in certain food items, allergy to certain medication, insect stings, sunlight, and sometimes the causes are even unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can actually worsen the symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, kind of test required for its diagnosis, and the right treatment and management approach for an early relief. So today we have with us Dr. Smriti Choudhary, live from Bokaro, Steel City, Jharkhand, talking about urticaria and its management. Dr. Smriti Choudhary is a dermatologist in Bokaro, Steel City, and has an experience of 7 years in this field. Dr. Smriti Choudhary practices at Nand Gopal Medical in Bokaro, Steel City, and KM Memorial Hospital in Bokaro, Steel City. She completed MBBS from North Bengal Medical College and Hospital, Shiliguri in 2015, and MD with Dermatology and Venereology and Leprosy from NRS Medical College and Hospital in 2019. A very warm welcome to you, Dr. Smriti. It's a pleasure to have you with us. And today we are going to talk on a very important topic, urticaria and its management. Welcome.
Thank you, Sanjukta, and good afternoon to everyone present there and the ones who will be joining. So let's straight away jump into the exciting session.
Yeah. Definitely. Without wasting any time, we'll jump into the question answer session and try to understand what is urticaria and how we can manage it. Now, initially, we'll start by understanding what is urticaria.
Yeah. So urticaria is nothing but just a medical terminology which is used for hives or wheals. Let me make it a bit clear. If somebody is well versed with these terms, these are actually just a normal skin itching, swelling symptoms are there. Those are called in day-to-day language as wheals or hives, which we doctors term as urticaria. So urticaria, widely it can be categorized into two types, which you already, I think you just mentioned. Ones which we get during, I mean, it's less than 6 weeks, so it's called acute, and the ones which has already troubled the patient for more than 1.5 months, they are categorized into the chronic urticaria. So urticaria is nothing but itching, but then itching can be due to a lot of causes, lot of reasons. As we progress through this session, I would explain all those lesions and all those things which we get for classifying it into urticaria. Yeah.
Okay. So let's start with the causes then, doctor, because you, as you said, there can be n number of causes. Right. So what can be those causes responsible for urticaria?
So for us doctors, causes are something different. We go at the molecular level, we go at the pathogenic level, the mediators, the chemicals, the neurotransmitters, mast cells. So I won't go into that detail. For common audience, more than the word cause, I would like to use the word trigger. So what are the triggering factors for urticaria? So, and these triggers are of more importance in case of acute urticaria. So the most common ones are the ones where we don't get any cause. it's very difficult to take, to pinpoint a particular cause for getting urticaria. But then there are certain other reasons, the triggers, which I would like to share with the audience.
Sure.
Most common one will be the food items. Food items, you just can't ask every person presenting with urticaria to stop those food items. That has to be experienced multiple times by the patient. He has to stamp it. First one is seafood, then it can be eggs, it can be brinjal in certain patients, it could be groundnuts, peanuts in few patients. Then the food items where there is additive, the preservative ones, the coloring agent. So the chocolates, the candies and all, which are colored ones, especially for the kids. And then we have got the baked items, the cakes and all, ice creams are there. All those contain the artificial coloring agent, the sweets. So they have been known to cause urticaria. Apart from that, there is a list of food items which we just ask the patient to be careful about. It might range from masoor dal, then we have all those the vegetables like your even your spinach, your tomato. So a long list is there. Apart from food, insect dermatitis, the contact with insect like bees, then we have bumblebees, wasp, beetles, all these in the long run, even if there is a contact with the clothing, it has been known to cause acute urticaria in patients. Apart from that, we have a very important class of drugs, and they have been notorious to cause acute urticaria. Yeah, so these are the few important ones. And not to skip, there are certain infections after which patients can get urticarial episodes. The those ones which are caused by mycoplasma, other viral infections, they might lead to urticaria, and that is in acute onset. Apart from all these things, uh, the other ones which we commonly encounter is the one due to dust. Then coming to the chronic ones, which patients get through a very long time, it might be because of sun exposure. It might be cholinergic urticaria. There is a change in the temperature, the inner temperature and the outer temperature. Like we just get out in the hot outside, and then suddenly we come inside and switch on our AC. So the sudden change in the temperature. Yeah. Apart from that, exercise induced urticaria is there. Few people, when even when they run through few stairs, they start getting itching. Sweat urticaria is there. Yeah. So and then even aquagenic urticaria is there, when there is just patient, even if he or she washes their hands, it starts with small lesions and starts with itching. There is vibratory urticaria. In case of any sort of vibration, they start feeling itching. Then we have pressure urticaria. Wherever there is tight occlusion, whether it can be because of the belt strap or the watch strap, there urticaria. So there is end number of causes. Yeah. Okay.
By what you just said, I can make out that, anything under the sun and even the sun can trigger urticaria. And many a times the reason is untraceable, or, the doctors can't understand why and what has triggered urticaria. Now, doctor, as you said, urticaria is like hives, or, they are like bumps or rashes that forms on the skin. Now, the thing is that many a times in whatever skin allergies we have, the symptoms are very much similar. We do get rashes, they are red in color and they itch. But we would like to understand from a layman's perspective that how can we understand that what's appearing on our skin can be urticaria. So how does urticaria look like?
Yeah. How urticaria looks like, right? So it's firstly, it doesn't stay for long. If it stays for long, then diagnosis will be something else.
Okay.
A class of urticaria also presents with more than 24-hour lesions, but then that is something serious that comes into vasculitis and you need to see the doctor. So what we are going through the general urticaria lesions, there is swelling, there is slight swelling, which we call in medical terminology as edema. So there is slight edema, there is slight raised temperature. When you feel it, you'll feel a bit of hotness over the raised area, and that will be that will be circumscribed. It won't be diffuse like whole of your hands or face gets swollen. That is something else. Just diffuse small area in few centimeters or even millimeter, multiple lesions of millimeter, and slight redness will be there. So classic urticaria, the wheals are slight swollen up skin with a bit of raised temperature and slight redness, which disappears within, I think, minutes or hours. It doesn't stay more than maximum of 2 to 3 hours.
Okay. And doctor,
Yeah.
can urticaria be a serious condition? I mean, how serious can it be?
Yeah, urticaria can be serious when it presents with something we called as angioedema or
Okay.
anaphylaxis. So what angioedema is, it involves the deeper skin, the dermis. There is dermal edema. Okay, so that edema, it can affect our face, the lips, even our larynges, our oral cavity. So it will be difficult, it will be hampering our breathing process. So apart from these external things, it can affect our gastrointestinal tract. There'll be diarrhea, there'll be respiratory distress, even renal involvement, and patient might lead to go into anaphylaxis. Anaphylactic shock is there, which is a life-threatening condition. So to be very, precise, not urticaria. Urticaria is not serious in case of being life-threatening, but then it can be, present at some point of time with angioedema or anaphylactic shock too.
Okay, so in those cases, urticaria can become life-threatening or serious. Now, as we were talking about, and you said that there are in two categories we can put urticaria: acute and chronic. Acute, you said, is like almost 6 weeks. You know, if it's getting better in 6 weeks, then it's acute. Otherwise, we can categorize it in chronic urticaria. Now, the question is, what are these chronic urticaria hives? I mean, why they appear or why they are not going away? And with treatment, can they completely go away forever?
Now, this is a tricky question. Actually, urticaria has been a menace for coming back again and again. Actually, we have termed it, we have categorized chronic because it keeps on coming again and again. It's not like once chronic urticaria, the lesions come, then they don't go away. They go away, but then they come back again. In case of acute, no, it goes and come back, and after 3-4 episodes, it disappears. Yeah, but then for being a chronic, every second or third day patient will complain of getting those lesions. So it's really, it's very difficult. It can even it can go for 30-40 years. It can trouble the patient for that thing. And the causes, not only external, even our autoimmune problems. There are certain group of autoimmune disorders where this sort of chronic urticaria can present with. Also, endogenous causes might also be there. Even the serum, the component of our blood, even there are antibodies against those serums. So those can also trigger. So it's really difficult to point out a cause, and especially to completely stamp that patient has been cured of chronic urticaria. We can just control chronic urticaria.
But treatment is there, right? And the patient can get relief, right?
Yes, definitely.
We'll talk about it later in this session, but right now I would like to know that what are the potential complications of urticaria if left untreated?
Yeah. If you leave it untreated, the most important thing is patients. Patient is very much stressed. He or she loses his or her sleep. That is the most. Their daily life activities are hampered. So that is most important complications. When we'll go further and talk about stress, so that is the most important concern regarding urticaria. Patient is very much distressed of itching. Sometimes the itching is so severe that they can even scratch off the skin. That can lead to secondary infection, sepsis, especially in case of those diabetic people, the old aged people. So that is most apart from those rare conditions where the severity it takes to angioedema and shock, all those things, those are the rare situations. But the most common thing is the patient is distressed of itching. He or she can't go publicly. It really affects their social personal life. That is the main issue of urticaria. Yeah.
Right. It do hamper the quality of your life, and I can actually visualize how much discomfort a patient could be in, with a lot of itching, etc. And as you said that, stress is definitely associated with urticaria because with urticaria, when someone is continuously itching, he's not going out in public or socializing because he has this, not to fall in any embarrassing situation, and
Yeah.
people start getting aloof from the mass or the people. And as so much of stress is associated, what I would like to understand, doctors, can urticaria be aggravated by that stress again? And how do stress urticaria looks like?
Okay. So yes, emotional stress, it's difficult. Many papers have been published, but it's difficult to establish whether stress leads to urticaria or vice versa. But then there
Okay.
has been a combination. There has been like uh, uh, both go together. I mean, patients with anxiety, depression, the maniac problems, mood disorders, those patients are definitely complaining of urticaria. So it's difficult to establish whether the stress has led to urticaria, or whether because of urticaria patients has deteriorated into some psychiatric problem.
Mhm.
Yeah. And what was your second question?
Yeah, I
How does
mean,
it look like?
yeah.
So, see, morphologically or by visualizing, it's not different. All those
Mhm.
urticaria lesions, all those are very much similar, apart
Mhm.
from the distressed look of the patient. If the patient is anxious or depressed, the look will be different. Patient will be very much agitated. Apart
Right,
from that,
exactly.
skin lesions are more or less similar.
That's why it's important to go and visit a doctor, a qualified doctor, and get relief. That's what the message we are continuously trying to give through this session. Many patients do complain that during night their urticaria get worse. What's the reason behind that, doctor?
Yeah. So this is really, I mean, every patient really asks, madam, I get it in evening only, when I reach home from my office, and when I open my clothes, and then I start itching at night. I start itching. So let me tell you, one of my HODs, he was very much interested in this fact, and according, I would quote his lines actually. So what he said is, itch is not a painful sensation, it's a pleasant sensation. So
Mhm.
itch is something, it's definitely because of the chemicals and all which are released. But this thing, while we scratch our skin now, for some time, it gives us a bit of satiety or pleasure, or we are cool with that. The main problem starts after that, when the skin starts burning. So
Mhm.
since you are very much busy in your day, activities during daytime, even if you there is slight itching sensation, you might neglect it, or the moment you start itching, you are involved in some other activity, and after few seconds the feeling goes away. But then at night you are almost free, you are concentrating on your body, every sensation, and thus you go on scratching also. uh, this is a vicious cycle. The more you will scratch, the more itch it will generate. So
Mhm.
these two factors are there. So if I especially ask my patient to just go and buy a rubber ball, the smiley balls, and whenever you feel that itch, the sudden impulse of itching, na, just press those balls, and that helps a lot. Yeah.
Okay.
And the second thing which I observed, that patient go out from office and then open their clothes, and then that might be because of sweat first thing, and evaporation is there, change of temperature in the body is there. That might be a reason why they feel it in the evening or at night. Yeah.
Okay, so as during the day we are mostly preoccupied, so we kind of neglect or ignore the signs of itching, but during night we have ample time to actually scratch, and that's how it becomes worse. So it's nothing to do with I mean, there can be other factors as well, but then it's all because we are,
There will
concentrating.
be other factors. There might be other factors because of bedding and all.
Mhm.
It might
But
be
yeah.
the dust mite and the sheets, the detergents, remnants. When we sleep, now there is slight sweat generated, and the detergents, which even remains present over our blanket or our bed sheets, that might cause
Mhm.
irritation, itching. It might be
Mhm.
because of bed bugs. There are n number of reasons actually, but this
Exactly.
thing, these things are, we really have to take proper history, know about the patient. Yeah. Okay.
Exactly. And many patients also say that they feel very tired, fatigued, who are, suffering from urticaria. So why that so?
See, one of the important medical reason for that is hypotension. Sometimes urticarial episodes are associated with decrease in blood pressure. So that might be because of this thing. Second thing is the psychiatric, the distressed, the stress, anxiety, the I mean, the pressure of not teaching and then feeling the age. All those things, they cause the patient, they, it leads to a feeling of this weakness. Yeah.
Exactly. Now, doctor, initially, as you were telling us about the causes, you said that, allergy from certain food items can also be one of the triggers of urticaria, and many a times that do happens because of that. Now, I would like to ask you, is there any dietary precautions? Because you, as you said that, with seafoods or eggs or peanuts, nuts, etc., cheese, there are so many things that people are, allergic to. Now, is there any dietary precautions or do's and don'ts for patients of urticaria, even if it's not, I mean, clear whether they are allergic to these food items or not? But still, in general, is there any dietary precautions?
Precautions, I would just say that it varies from person to person, and he or she himself has to establish it. But then
Mhm.
generalizing those things, I just advocate avoiding the use of the preservative things, the artificial pickles and all those colored items, just
Mhm.
avoiding those things. At least I mean, they are even not very healthy also. So
Right.
that one thing which we can ask the patient to stop, that can be
Mhm.
universally accepted. Rest all the food items, everything has is, it's completely personalized actually.
Mhm. Many a times, because now people are so aware of various lab tests, etc. As now they can do some tests to find out what they are allergic to. So many a times, before even going to a doctor, consulting doctor, people will just go straight away to the lab, get the test done, and then go to the doctor and say, see, I'm allergic to 30, 50 food items. So, and I'm going to avoid these 30, 50 food items. Which is practically not possible, or practically not a very good thing to do. Now, what do you suggest as a doctor? I mean, can a person directly go to the lab and do these tests because they are expensive at the same time? Or they should first go and consult the doctor, and the doctor will advise what to do, what not to do.
So this is the very important question, and through your platform I really want to advocate against this allergy test. I mean, never ever a qualified dermatologist would ask a patient to go for allergy test, because one thing, the most common thing which comes positive there is the parthenium plant. Parthenium, it's a plant, it's a, I mean, every, it's present everywhere. It's you will get it everywhere. And what are you going to do if you are positive, you are allergic to parthenium? Are you going to seclude yourself inside a house? So Apart from that, all those food, it just gives some sort of satisfaction, temporary satisfaction to the patients, because it's of no use. It's really of no use. Even if some food items come positive in those lesions, cashews and all those things, I've seen many patients who have really left so many food items after they got that report of allergy, and then they are weak, they are devoid of certain minerals and vitamins. So what's the use? Why are you, I mean, and also food items are not the only causes of urticaria, so why to go for it and waste money behind that? There are certainly few tests, but those are blood tests, the ones in which we go for when we get resistant cases. So please, no need to go for any sort of allergy tests. It's really useless. What we go for is a patch test. That is a scientific thing. We have certain chemicals which are present in, like hair dye or shoe polish or cements. So there is a battery of chemicals, and that is applied to the skin, and then we see if there is any reaction and all. But then that is at our discretion. Even patients can't go for it directly, and there are certain indications where we go for those patch tests. So no need to go for allergic testing. There is no scientific basis behind it.
Okay, so now at least we know that in case we have an issue, please go and consult your dermat rather than going to a lab and getting your allergy test done. It's of no use unless the doctor advises you to do so. And doctor, what about the over-the-counter medication that people, often do, and they do because it's causing due to some allergy, right? So they'll just go without any prescription, without consulting to the doctor, and take allergens from the chemist and have them. Once or twice, it may be okay, but then there are people who will continue doing so. What's your take on that?
Really wrong, because neither are you aware about the mechanism of action, neither you are aware about the side effects. Even I have seen one patient, she was 50-year-old. So that lady, she had been taking antihistamines, class 1 antihistamines, for last 30 to 35 years, and now she has got addicted to it. She passed away just last year. She was addicted to it. She had all those, I mean, it, because it is sedative. Right. That class 1 antihistamine, that is sedative. So she was addicted to it. So why to start those things? You are not aware of the dose. You are not aware whether it is metabolized in kidney or liver, whether your kidney is able to excrete that amount of antihistamine. You are not aware whether how long you have to take it. You just take a tablet, just gulp it, you then for 2-3 days you'll be relieved, and then again third fourth day you will start it. That's not the mechanism, that's not the thing. Once the chemicals are raised, the chemicals, the immunoglobulin E, IgE levels, once they are elevated, just taking one medication spot on and then leaving it is of no use, because at the end, again, once you stop that medication, it will again reach to that level. So why to take all those things? You are spending your money, you are giving so much side effects to your skin. So better to just avoid it. Not even once you should take it. Emergency situations are something different, but then don't take over the counter medications. We have certain classes of medication, we have certain doses which we upgrade or downgrade. There is some science behind it. Right. So just don't take it so lightly. I mentioned one case where addiction was there. So even if because skin diseases are something which everybody thinks they can treat it by themselves, or right, through some quack, or just medical shops. So because it's visible, and you see it's that, and then we can go there, and if by chance it gets treated, and then you will start taking it again and again. So please don't take skin diseases lightly. These are also an organ of our body, and these are very much connected with our blood vessels, with our internal organ. So whatever you are even topical application, whatever you are applying it. Not only over the counter medication, even patients start applying certain irritants like turmeric, like the neem leaves and all those things. So after that they end up with irritant contact dermatitis, so they now get some other illness. Urticaria is left far behind. So please don't go for unscientific things. Don't take medicines as candies. Yeah.
Exactly. That is the most important thing, because skin is an organ. It's the largest organ of our body. So we need to respect it. We don't have to abuse our skin again and again. And the
Exactly.
thing is that by over-the-counter medication, in many countries, it's banned. I mean, in India, as in our society, it's easily available. So we are using it like anything, and we are actually harming ourselves.
Right.
So please don't go for over-the-counter medication. Please don't go for self-medication. Please don't go for home remedies, especially in case of urticaria, because ultimately it can be due to an allergy, and maybe you are actually applying what you're allergic to. You don't know. So that's why you need to go to the doctor and ask for their suggestion. Don't just go by what the influencer on the social media platform is saying, or what creams are there, or what your family or friends have used. Everybody is different. Everybody's problems, I mean, the term may be the same, but then the causes can be n. So please consult a doctor. That's why the doctors are there. That's why they have studied so much for so long. So please respect that. Respect your body at least. That's really important. And doctor, another thing with urticaria, another thing with any skin, allergy is that people feel I'll get it from him or her if I get come into contact. So is urticaria contagious?
It's not contagious at all. Yeah.
Okay.
Because it might be like a chance, I mean a thing of by chance that two siblings or father or son they get. Definitely there is genetic predisposition, but then
Mhm.
uh, it's not contagious, not at all. One more
Okay.
thing, if a family, two or three members of the family are getting urticaria, that might be because of the dust, that might be because of the bed bug you are having, that might be because of something you are eating. So
Mhm.
that's not contagious. The causes might be same. You might be genetically similar, so it might be because of that. But definitely, it's not contagious. Yeah.
Okay. And what are the treatment options available to treat urticaria, doctor?
See, broadly defining, most important thing is the counseling. Patient is so much, I mean, most of the class of the patients, they don't know what I'm having, what I'm getting. They're not aware of the words like hives and wheels. They're not able to describe. And so they're so much stressed. They are anxious about what I'm getting. It's going away. Then again, it's coming back. So education, counseling, patient has to know that, okay, it is this, it might be allergic, it might not be allergic, and I need not to take so much stress about it. First thing. Second, which you very well mentioned, abusing the skin. Many a times dry skin, irritated skin, that all even come up with urticaria. So moisturizer application, less of soap application. These are the precautionary measures. Coming to the treatment, definitely we give some soothing lotions. There are certain ingredients like calamine and all. Premoxine is there, the topical ones, and oral. There are multiple classes of antihistamines, which we decide according to the patient's background, the associated disorders, the age, sex, everything, and then we decide for the antihistamines medications. Yeah.
Okay. And with that, we have so many viewers who are pouring in their questions. I'll try to take one by one. Priya Sharma is asking, for chronic urticaria, is there any cure, and what food medications should be taken?
What medication?
What food medications she is asking? I think there is a comma in between what food she can take and what medication she can take.
Okay, so for urticaria, cure is not there. You'll have to take precautions. You'll have to consult a doctor and come up to exact reasons, causes. You'll have to work upon it. The tests, even stool test can help. it's because of certain parasites, strongyloids, all those things that has to be detected. So there is battery of reasons, so many causes of urticaria. So once we once we start protecting ourselves from this, definitely you won't get any such lesions in future. And regarding food, we have already discussed, I think, regarding the food and all.
Yes.
One important thing I would like to say, it can be because of drugs. Even certain medications can lead to, especially some antibiotics, the painkillers, the hormonal medications, those can lead to urticaria. You have to be vigilant. Just be cautious that I have taken this medication and suddenly I'm feeling a bit of tingling, irritation, and then the skin has swollen up. So just meet a doctor after that.
Right. And also remember the name of the medicine that you
Very
took,
important.
so that you can, in the future, you can avoid it, or at least tell your family or doctor that you are allergic to this particular medicine. I think that's equally important.
Yes.
So we have Aman Verma with us asking, क्या अर्टिकेरिया जानलेवा बीमारी है अगर डॉक्टर को न दिखा पाए तो?
या अर्टिकेरिया एज इट जानलेवा बीमारी नहीं है, बट इन सर्टेन केसेस जब आपके केमिकल्स, जब आपका लेवल बहुत ज्यादा बढ़ जाता है, इन दैट केस एनजीओ में एडिमा बोल के जो टर्मिनोलॉजी जो होती है, उसमें आपको लाइफ थ्रेटनिंग सिचुएशन आ जाता है. इट माइट अफेक्ट आपका इंटरनल ऑर्गन्स, आपके अफेक्ट हो सकते हैं. आप ब्रीदिंग प्रॉब्लम, ब्लड प्रेशर डाउन होता है. सो इन सर्टेन केसेस जानलेवा हो सकता है.
तो मैंने आपको आपका जवाब मिल गया है, लेकिन फिर भी डॉक्टर को दिखा ही देना चाहिए, क्योंकि भले ही उस सीरियस कंडीशन तक ना भी पहुंचे तो भी आपको डिस्कम्फर्ट तो है ही.
Yes, which episode, which urticaria can lead to this situation that you can't guess. So you'll have to consult a dermat for that.
Exactly. Prasanjit Singh Gupta is asking, ma'am, in pregnancy, sometimes urticaria occurs. Which medicine you suggest in this condition?
So without seeing the patient, especially pregnant patient, we really can't suggest any medication, because it depends on the stage of pregnancy. Every stage is different. Medication is different, body weight is different, comorbidities are different. But definitely you should not ignore itching, even if the urticaria lesions in case of pregnancy, because there is a term called cholestasis. The cholestasis, there is stasis of the secretions from our bile duct. So that is a grave situation for the fetus and pregnant lady. So never ever ignore urticaria lesions in case of pregnancy.
Exactly. So you need to consult a doctor anyways, but then if you are pregnant, that please be super serious about it. If you have urticarial conditions, or you have urticaria, please go and consult your doctor as soon as possible. And doctor, before we bind up this session and conclude this session, any takeaway home message for our viewers?
Definitely, there are few of them. Firstly, just avoid taking over the counter medications. Please don't do that. That is something which I mean 60% of the patients, they have already tried so many things, but the dosing and all those things, and that is a menace for us, because again restarting those, you might have ended up with damaging your kidneys or something. So please don't do self medication, even if it's for urticaria. Yeah.
Right. So thank you so very much, Dr. Smriti Choudhary, for your valuable time. And it has been a very informative session for our viewers. And I'm sure they will use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, they will now know that instead of, self-medication or over-the-counter medication, it's always better to approach a nearby dermatologist. So it was a pleasure to hear you, and we really look forward for many more such sessions in the coming time. Thank you so very much.
Thank you. Thank you, Sanjita.
Thank you, viewers, for your participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page, All About Skin Allergy. We are also available on YouTube, Twitter, and Instagram. Thank you. Good day. Goodbye.